Hi everybody, I'm Joe Sestak, Congressman from Pennsylvania's 7th District. I'm really happy to talk to you today about the health care issue that we're dealing with down in Congress. Not passing health care reform is not an option. Over my shoulder you can see my daughter. I got out of the military after 31 years, and then I entered Congress because she was struck with a malignant brain tumor. And I had TRICARE, the health care plan that you all provide the military, so that she can be here today. Everyone should have the opportunity for the quality health care that I had, and that's why I entered Congress. President Obama is giving us this opportunity, and your activism and your push to ensure that Congress passes it this year is absolutely critical. Why? We'll take those out there that do have health care today. You're actually going to be paying less. Why? Because you will now not have to pay any co-payments for the preventive care that you need. The colon rectal exam, the mammogram, the glaucoma exam, the bone density, free exams. Because we don't want you to delay until you're ill. We want to find out about it early so you have better health care. And also, this economy, you pay less. We also want to ensure that no insurance company from here on out can deny anyone, like my daughter, for a pre-existing condition. We also want to make sure that there's a public health care plan option. It's absolutely essential. Why? Because we want to make sure, like here in Pennsylvania, where 2 insurance companies have 70% of all private health care plan options, where we call that a monopoly, that there is truly competition so that you pay less. And that's what the public health care plan option bodes for the future. And those who are uninsured out there, we want to cover you. Because there's several reasons. First, it's a right that you should have, a responsibility of ours for all Americans to have health care coverage. And second, everyone out there who does have private health care plans actually pays for the uninsured. On average, for a family of 4, their health care plan is $1,100 more. Because when those who don't have health insurance go into the emergency room for their care, usually more acutely ill, then the hospital passes that cost on to the insurance company, who passes it on to those that have health care plan coverage. Here in Pennsylvania, between 2001 and 2007, the price of premiums went up about 86% as we did nothing. Bring in the uninsured. Cover them, because their preventive care will mean we will pay less than we are today. And our economy that loses $100 billion a year of lost economic productivity will no longer do that, because that's what we're losing per year, because of the loss of the uninsured in work days when they're more acutely ill and waiting to be taken care of at an emergency room. At the end of this, all I ask everybody out there to do is please continue your community activism. Let everyone know in Congress that doing nothing, as we did for the past 8 years, is not an option, either for the health of our citizens, who deserve what my daughter was given by you. And why I got into Congress is to pay you back and say thank you, so everyone had the same coverage. And it also means that your pocketbooks, our economy, the price of health care for those that have it, is so much more by not acting. Thank you very much for what you're doing. I'm glad to be part of your team. Joe Sestak, Pennsylvania's 7th District. Thank you again.